Right now, Healthcare.Oops is the bungled rollout of Obamacare, turning the president's signature program from the government version of Facebook to MySpace. New numbers show the impact of the rollout problems and the impact on the president himself here, all as the grand old party photo ops continue on Capitol Hill. And later, a point? No point. Republicans in the Senate filibuster yet another Obama nominee. We're going to ask why here tonight. And also, delays are causing problems and changing the way Washington works or doesn't work. If you think it's just typical Potomac two-step stuff, there is real consequences when we can't get people into the jobs they're appointed to. And then, with more than 2,000 Filipinos feared dead from what may be the strongest typhoon ever to reach ground, new focus is now on climate change. It turns out Americans believe and want changes. The question is, will and can lawmakers do anything about it? All right, good evening, everybody, and welcome to RFL. I'm Richard French, and thank you so much for joining us this Wednesday evening, November 13th. And we start here with the latest healthcare headaches for the president. Last week, President Obama apologized for telling Americans they would not have to give up a health insurance plan if they liked it. But if the trends continue and people's views of healthcare reform don't change, there might be more apologies yet to come. For more on a busy day on the healthcare reform front, let's bring in Andrew Whitman, our senior political correspondent.
And Rich, let's start with the latest numbers. And after speculation from sources this afternoon, we got our first official reporting of health reform enrollment from the Department of Health and Human Services. That number, 106,185. That's how many Americans enrolled for healthcare insurance via the new Obamacare exchanges from October 1st to November 2nd. As for the breakdown, the lion's share of those enrollments, nearly 80,000, or about three-quarters of them, came from the state exchanges. Just 26,000 came from the federal exchange and the website Healthcare.gov. That is a huge problem for the program, since those 80,000 state signups came from just 14 states. People in the other 36 states must rely on the federal exchange. But those numbers may not be the biggest worry at the White House tonight. The 106,000 enrollments, well short of the 500,000 targeted by the White House, just 20% of the way there. That number should be up to 1 million by the end of November, and falling short of their goals could jeopardize the financial foundation of the program. Meanwhile, on Capitol Hill today, the focus was on the healthcare website and its botched rollout that opened the floodgates for healthcare reform complaints and likely suppressed enrollment. The White House tech team focusing on the fix-it work now in progress. The GOP questioners focusing on the problems.
I only want to know, on day one, was the capacity sufficient?
I can't speak to the numbers that you were talking about, but clearly on day one, the system was overwhelmed by volume.
The timing of the enrollment numbers not good for the president. They come a day after former President Bill Clinton said in an interview he thinks Obamacare should be changed to let people stay on the plans they have if they want. That interview fueling complaints from dozens of Democrats in Congress, pushing Obama for flexibility on the issue, and airing complaints during a meeting at the White House today. And then there are the president's poll numbers, which came out before the underwhelming enrollment numbers. Quinnipiac gives the president a 39% approval rating, the lowest of his presidency. Gallup's at 43, but it's under 40 on health care, on the economy, and on foreign policy. Bad news for the White House, worrisome news for Democrats positioning for the 2014 midterms. Rich?
Andrew, thank you very much. And for analysis and maybe some gloating over the dark clouds now over Obamacare, we bring in our panel. I say that tongue-in-cheek. Chris Chase, former Connecticut congressman, distinguished fellow in public service at the University of New Haven. Next to him, of course, familiar face, Dominic Carter, political journalist and author. And on my right, where he belongs, Richard St. Paul, Republican strategist and a former vice chair for the National Black Republican Association, and Andrew, who you've met. Okay, I'm going to start on the politics stuff, and then I will get to the policy. On the politics front, there's an acknowledgement, I think, on the White House. They got a big problem here. And it's not just a problem that the website didn't roll out right. There was a problem for messaging. There was a problem, I think, even with some of the core elements on it. The president says, hey, you can keep your plan. Maybe not necessarily. If he comes back to Republicans or to Congress and says, I want to make some changes, do Republicans say, hey, I remember the hot mess we got ourselves in over default here and government shutdown. We're willing to negotiate. We want some things for ourselves, but we're willing to negotiate. Or do they take the position to fund the whole thing? That's the only position we'll take. We won't even negotiate on the margins.
No, I think what you're looking at already in the Senate is a bill called the Affordable Care Act, Promise Act. Meaning the president's promise that if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan. That act is in the Senate and has picked up support from Senator Feinstein. I think coming through the Senate, I think that act gets support, builds momentum, and I think the House will come along with that, because I think certainly when you have 2 million more Americans than several weeks ago who have now lost their insurance, you have to react. And you have the 2014 election around the corner too. So I think you have to react, you have to react quickly to make sure that people.
So you think the
have
party's
those
off the
health
defund thing? They've acknowledged that it's here. They may not like it, but it was in the last election. We started the shutdown here. We've seen the poll numbers.
I'm not so sure that people who consider themselves Tea Partyists and both the Senate and House are off of that. But I certainly think the need is to make sure that we don't have so many Americans without health care insurance. I think there's a need to react.
There's enough of a Republican base to say, listen, we're dealing from a position of strength here. The poll numbers and all the metrics Andrew said here show that the American public is, at best, circumspect about whether this thing's going to work.
No one's dealing from strength down in Washington right now. I think that Congress is at 9%. So it's the bottom line is the president didn't misspeak, as the New York Times said. He told something that wasn't true. And he's paying the penalty for it, and so are we. He then says, well, the plan will be better. You can't get what you want now, but you'll get something better. No, they should have the choice. If they want what they had, and it's not as good a plan, but that's what they want because they want their doctors and so on, they should be allowed to keep it. So Congress would be well advised to make sure that at least this part is corrected.
But can he correct part of it without having to basically relitigate the whole thing?
Well, they're not going to relitigate the whole thing, so that's not on the table. But I think now they've got to just hold him accountable to what he said.
What do you think his biggest problem is, the president right now on health care, Dominic? Is it that from within, first the president, then you got to think other Democrats who say they don't want this saddled around them as the clock turns to 2014 and they got midterms, in not too long from now? Is it that you've got people who say, wait a minute, I thought this was one thing and it's something else? Or is it the website can't work and it looks like the gang who can't choose her? What's his biggest problem?
He's got several problems. One is a perception problem, and the perception that this thing just doesn't work. And so Republicans don't have to attack anymore. They can just back up. And it's just one big mess.
I wish they would listen to you.
and then he has another problem, Congressman, because what if the point that you're going to, what if they have to open this thing up to correct it and go before Congress again? I just don't know if the Republicans in the House can stop from attack.
Deal with the specific rather than the main. But, Andrew, I heard from a lot of people who support it and still believe in the premise of it. I believe in the premise of it. It's not a good thing in this country when you have 50 some odd million people without health insurance and you talk to people who are on the front lines. It's not sustainable. But if he doesn't make the numbers here, forget about November 30th. We also learned today they're not going to have this thing all straightened out, the website, by November 30th, which was a date that we were told just a week ago.
It crashes if there's like 40,000 people using it at the same time or something like that. They can't get past that.
If they don't make their numbers by the real date, which is, I guess, the spring, okay, what's he do?
You got a couple of possibilities. You can either push back some of the deadlines and continue the open enrollment, give people a longer window to try to get this thing operational. You can operate it at a deficit for a short term. It needs younger participants in order to sustain
healthy participants, right?
To sustain the extended health care benefits and insurance.
But I guess my
other
problem
people.
is on that front. You said it right. I agree with you. But that's the very population he's having trouble, even if they can get through the website, to sign up for it because they're matching their plans, and it takes too long to explain. Honestly, but they feel that they have a better. They can get a better plan here on the existing landscape than they can through Obamacare. And they're like, why do I want to sign up for this?
The numbers are a problem, but I don't think it's the biggest problem for the president right now. I think Dominic touched on it. It's this idea that once it becomes fodder for the late night comments, which it already is to a certain degree, once it becomes solidified in the public's mind
as a joke,
as being whatever short of what they want it to be, it will forever be that. And to try to get, look at Mitt Romney, how he was defined in the pop culture in the 2012 election. And no matter what he did, he could never get away from that. If healthcare becomes a joke, it will never be anything but, and you can try to fix it all you want, or if Hillary Clinton's out there thinking that she can have a go at it, or if Chris Christie thinks that he can have a go at fixing it, you're not going to be able to. I mean, you're talking about the kind of thing that will restrict the ability to deal with healthcare for a generation. The last time we tried healthcare was a generation ago under Bill Clinton.
And if you step back, and they're going to do this, because a website couldn't work. I know it was more problems than just the website being operational, but at the core of it, the most tech-savvy campaign in the history of the world, okay? That these guys could run the most scientific campaign using technologies and metrics and way to leverage assets like nobody could think of. And they can't get a website to work that they've been talking about for 5 years. It's just mind-boggling.
Not only that, Richard,
and then blaming on procurement, please.
You've got a young lady that was the face of this campaign who's on national television crying.
A little bit of a drama queen, don't we think?
Okay, but nobody wants to be associated with this. The president his legacy is really on the line.
Yep.
And I think in addition to that, you have the debt ceiling renegotiation coming up. You have the government.
We'd forgotten about that.
Right? Government shutdown deadline coming up. And I should just say that the government is running to a certain point. I think that was January.
You guys are so
February.
lucky.
So there's a lot of stuff on the table, and I think what you might actually see is the personal mandate may be extended, and I think that's certainly something I think the Obama administration should consider.
But I'm saying if the Obama administration said, hey, GOP, you know what? You guys want malpractice reform? You guys want us to take the medical device tax out of this? He may even have a point here, even if I don't want to do it under the that I'm having to capitulate to get what, but fine, we'll do it. I'm saying if they came to the table with things Republicans want, so Republicans have a pelt on the wall to say, see, look what we brought home, I just don't know that they'd stop there. And they wouldn't say, oh, you come back here, now we're going to relitigate the whole thing.
If the president comes in with some very real ways to fix the program, and the Republican Congress rejects it, then it's going to fall on the Republicans.
Yeah, and I expect, especially when you have Americans losing health care, millions of Americans losing health care, they're going to say, you had an opportunity to fix this, you should have fixed it. People are going to vote and say, we're not going to support you because you're not interested in fixing this problem. You've got to put a Band-Aid on that first and foremost.
I'm just not sure where either party has the political wiggle room on this. I mean, the Obama administration can't relax the thing with the bad policies because we're trying to fix these bad policies, and they can't admit failure because then the whole thing crumbles. And I don't really know how you're going to get enough Republican votes in the House with congressmen who are afraid to go home to their districts and say, see, I supported Obamacare on this vote.
I remember when we did this, and Andrew and I have done a lot with some of the folks at the Franklin and Eleanor Roosevelt Institute, and they said, look, and you could lay them side by side. When FDR tried to do Social Security, what did they say? Oh, big government overreach, blah, blah, blah. When LBJ brought about Medicare, same exact comments.
Yeah,
it was so similar. Now, though, the administration said, see, they're going to do the same thing. And we found some of the same exact comments. But there wasn't a competency issue in the rollout of those things. Now people say, whether you like it or you don't like it, if you can't make a flipping website work, why do we have to roll the dice on this? And that's the...
Let me tell you the differences. The difference is that we're talking about 16+% of the economy that the government now is getting really involved in. We're talking about huge entitlements that already exist, that didn't exist under FDR, where it started to initiate under Johnson. But they weren't already there having problems. We have problems with Social Security, we have problems with Medicare, we have problems with a lot of issues. And we have a huge deficit to which now we are adding to the deficit.
Okay, so but those two aforementioned programs, very popular with the American public. You say we're going to get rid of Medicare, we're going to get rid of Social Security.
No, I'm not talking about getting rid of it. I'm saying they're there and they have problems.
Absolutely. That's part of the reason of the government shutdown in the 90s, in 95, and recently is because of the cost of the entitlement programs. It costs too much.
And I got to hit a break here, but we're going to keep this conversation going online, everybody. Do you think they're going to get Obamacare right? Time, I think, running out on it for the very reasons Andrew just hit on here, which is you got to believe in the thing, and it can't be a punchline, even if you fix the website. So question is, if you do think they can, when? Head over to our Facebook and Twitter accounts here to sound off.